Thank you for inviting me. I appreciate it, and I appreciate you understanding that I am a nurse, not a technician. I have no IT background, and everything I learned in my 54 years has been by playing with the computer back when we had rotary phones. I don't know if anybody here remembers that, but so I'm going to speak from a nursing perspective and from a non-IT perspective, but how excited we were at INOVA to be able to participate in this. Being a nurse for over 30 years, and being from New York, I'm probably innately paranoid. So I'm sure you don't know any New Yorkers who are paranoid. I'm sure you don't know any New Yorkers down here in Florida either. So our issue is that I understand the concern people have for accessing something as important as their medical records. So it's not just your medical records. We actually have your social security number. We have a picture of your license. We have all of your demographics. We have your alternate home. A lot of our folks have different homes in different locations. So we pretty much know everything about you. And our patients tend to spend about 5 to 6 hours with us just on their first visit. So there's a whole lot we know about you outside of what you might get from the electronic field. Having that information then put into the electronic record is very telling about who you are. So when we had the opportunity to meet with Mike and Jen and talk about how to protect that information, I jumped on it right away. My mother's 83, the government's out to get her, and that's how she feels. She doesn't want anybody to know anything. And some of our patients are 18 and their entire life is on Facebook. So we have that demographic shift from, I'll tell you anything you want to know, to I'm not telling you anything, here's my driver's license and I'm covering up all the numbers, all you get to see is my picture. And no, you can't scan it. And no, you can't have my social security number. And are you sure you need my home address? So having that shift in thought processes from our patients and in that age demographic, 100% of our patients signed up for access to their medical records, which was amazing to us because we offered it to 100% of our patients and they all agreed. So for us to say to them now, we're going to give you this higher level of security is going to increase their experience. Please know that with healthcare, there's a real shift. When I first started medicine, you got paid for what you did. Then we moved into you got paid for how well you did what you did and whether or not you had a successful outcome. Now we're being paid on the patient experience. So how you experience your health care is how your provider is going to get reimbursed. And that's why you're asked to fill out surveys. And that's why your experience matters to us. Now, my patients, I have two populations. One is a corporate executive health group that their company pays for their annual health exam, and they come in once a year for this 5 to 6 hour experience. We do a very solid health experience for them, give them lots of recommendations, and send them on to their primary care physician to follow up for the rest of the year, and then we see them back a year later. After years of doing this, many of these folks never did the things that we told them, and we realized that we needed to kind of move to the next generation. So we started a physician's practice, but you can't really go from serving folks in a 5-hour experience to serving them in a 10-minute experience, which is what medicine is now. And we decided to open a concierge practice, which means patients pay to be our members. So when you're paying to be a member of a practice, you're expecting a higher level of service. This speaks to that higher level of service. Not only are we going to take great care of you, not only are we going to communicate all your test results back to you, you don't have to hunt them down. Not only are we going to give you access to your records, but now we're going to do so in a more secure fashion. And that authentication for us was really important. And from an IT standpoint, I didn't really connect the dots with how that worked. So for me, I had to look at a visual. I'm very visually educated. So in talking about this today, I was still looking for that connection. How is it that all these parties who are involved in the authentication can't then, because I'm paranoid, get my stuff individually? Who's to say that somebody in the DMV can't jump in and look at all my stuff? And the way it was then presented was, we all know about rope and how there are different strands in rope, and each one of the authenticating parties are one of those strands. And not only are they interwoven, but they're also sealed. So one strand can't see the fact that there's another strand there. So if there's all working together, one individual strand isn't going to work. You need all 5 or 6 strands. So for me, that made perfect sense, that I have authentication going on where the different parties can't individually get all my stuff. So for me, that was easy. That was a no-brainer. So that made me feel better as the paranoid New Yorker. And I'm sure that will make my patients feel better. Because for me, to be able to express that to them, then engages them in that higher level of security for something as important as their medical records and all their demographics and their driver's license and everything else that we have and put into their records. Now, I want to let you know that INOVA Health System is the largest healthcare organization in Northern Virginia, which is really where the Northern Virginia population resides. So we have very, very tech-savvy government workers. They're more paranoid than New Yorkers. And a lot of individuals who are interested in information, and information now. And so not only do we have this from their computer, they can get their records from their phone. We have an app that allows them to get their records. And because there are more healthcare organizations that have the same EMR system, electronic medical record system, that we do, they can get their records from that hospital. And we can get their records from that hospital. But that authentication has to happen. So having the patient authenticate that and the permission for us to do that is invaluable. So I appreciate the opportunity to tell you from our perspective, we are super excited to roll this out to our patients. And my staff are pretty much along the lines of my patients. Some care, go ahead and get that, and some don't care. I don't care what anybody knows about me. So it's really interesting from a medical perspective how we understand from the IT perspective how difficult it is to manage that system. And we appreciate everything you do, because without you, we wouldn't have an EMR in the first place. So having this deeper level of security, having that IT awareness, and having that authentication for our protection matters. So I appreciate being here to share with you not only our appreciation for what you do, but our excitement for rolling this out to our very, very tech-savvy patients and population. So thank you.